What's up, everybody? John Schumacher here with New Wave Healthcare, where business-minded health professionals come to learn and be inspired. Today, our guest is Mazy Holiday of iStandfit.com, a digital company that focuses on fall prevention for the elderly, and particularly using some really neat mobile applications to deliver evidence-based fall prevention techniques. So a lot of cool things we're going to talk about today, particularly when it comes to applications, digital products, fall prevention, all of those really neat topics that so many of us are interested in healthcare. So Mazy, thank you so much for taking some time to share your story and some inspiration with our audience today. Go ahead and just tell us a little bit about your personal background, and then we'll jump into your current business.
Hi, John. Thanks so much for having me on the show. I'm Mazy Holiday. I founded iStand Falls Prevention Exercise Program, specifically for seniors. We do use predominantly only evidence-based programs, Otago and Tai Chi right now, and we have a mobile app which is available on iTunes and Google Play. So you have an Android or an iPad tablet, you can download that for 99 cents. And we also have online streaming. We stream our programs online, so you can get the program anywhere, anytime, as long as you have a Wi-Fi or an internet connection. Mm-hmm. And the most exciting product that we're working on right now, and it's almost done, is a web-based application where you can use iStand with your patients one-on-one, and you can remotely monitor your patients and report on how they do their program from home. So that's kind of exciting. That's the latest thing we're working on right now.
Awesome, awesome. And so you created this live streaming program for your, do you do it mainly for like therapy clinics, or who is your clientele for this?
Predominantly, physical therapists are our target audience here. Now, the program can obviously be used by other healthcare providers, neurologists, for example. Stroke victims and Parkinson's victims can benefit from the Tai Chi specifically. So neurologists could use the program, as well as geriatricians, obviously, who work mostly with seniors over 65, but PTs are our main audience.
Oh yeah, got to get after those PTs and get them preventing some falls for some people. Definitely, definitely. So, how did you get the idea for this? Like, were you personally touched by something that influenced you to target fall prevention, or how did you get that aha moment that you wanted to start this for yourself?
That is a good question and a sort of a strange answer.
I like those.
I was working on another senior-related product, which was a walking cane. And the reason I was working on that was because I was personally touched by that particular need, in that I have joint pain. So I was doing research for the walking cane and just sort of came across accidentally the statistics for falls. And I couldn't believe it was #1. I'm like, why are falls #1? That just doesn't even make any sense. It sounds so simple. You know, you would think it would be heart disease or cancer or car wrecks even, but falls are the #1 cause of injury-related death for people over 65. And I was just so shocked. So I started digging a little deeper, trying to find out why it was #1. I mean, there should be some programs out there that are doing something about it. And there are programs out there, but there's no nationwide dissemination of one program. There's no organization. There's no nationwide organization going on. There's piecemealing. There's some classes here and there's some education here and there. But it quickly became apparent that what we needed was some organization. And also, we needed to be able to get this out quickly and effectively and efficiently. And the only way to do that today is the internet. I mean, everybody knows that. If you want to get something to somebody fast, you use the internet. So I thought that the best way to do it was to start with a mobile app.
Right. Yeah. So you sort of, like so many people, you had your antennas up and something came across your view and you went after it. So what was the
Hmm.
first step? So you created this app now, but back then, take us back
Hmm.
to when you first saw the statistic and you're like, oh my God, like I can't believe that this is such a huge problem.
Hmm.
There's all kinds of technology today, but I remember you telling me before in a conversation prior to this that no one was really targeting this with technology. Like, what was your
Yes.
first step?
Right. I'm a problem solver. I mean, that's what I do. And because I mean, I grew up on a farm, and if you don't know how to solve a problem on a farm, no one's coming to save you. Because first of all, they can't find the farm because you're in the middle of nowhere. So
Right.
you have to be able to solve the problem yourself. So I just ask myself, what do you do? What's the best way to solve this problem? And once I realized, it's the internet, and also affordability is a big issue with seniors. They don't have most of them aren't fixed income. So I knew that if I could create a mobile app that they could get to fairly easily, and download for free, then that was the answer right there. So that's when that's the first product that I started working on, was the mobile app.
Mm-hmm. And did you sketch out a design and then hand that off to a developer, or how did you start that process?
That's what I did do. Luckily for me, not everyone has this background, but I have a background in fine art, and I've been designing and drawing and building things since I was a kid. So it was fairly easy for me. I knew what I wanted in my head. I had the pictures and the colors and all that, and so I designed the screenshots, and then you have to do the user. What does the user see? What does the user do? How do they go from here to there? And you sort of map all that out with a wireframe. And then I hired a company to do the coding
Hmm. Okay. And then how did you fund it?
with my own money.
With your own money. So you bootstrapped it. Yeah.
I sure did.
Okay.
Well, that's what farm girls do.
Perfect. Perfect. And how long did it take to get the initial, like? Did you go through beta, or what was that process like for you when you were developing it?
Did you ask how long it take the
How
time?
long, or what was the process you went through during the development? Like,
There's a back and forth from, you send off the initial specs, and they come back and they have a lot of questions, how do you want this to work, etc. So it's sort of like a collaboration of sorts that you have to kind of go back and forth. And of course, there were things that I didn't know about coding. I mean, the last website I did was still HTML.
mhm.
So I'm kind of behind on the coding, but so it's a back and forth, and the time was probably, I would say, 4 months to get the whole thing completed.
Okay.
So, and that's probably about average.
Right. So here's a question that just popped into my head, and I'm just going to spit it out here. Um, how were you sure that people were going to use the app? I mean, did you ask questions to your target market? Like, how did you define your target market? Because we're talking about, a mobile app for elderly folks.
Hmm.
65 and older is, I guess, considered elderly. So,
Hmm.
were you concerned about them using the product, or were you concerned that there was going to be an issue there, or did you know for sure because you had dug in to
Well, I'll
that it
tell
would?
you, it was very apparent up front, because at the same time that I began designing the mobile app was in September, and I don't know if you know this or not, but September 22nd or 21st, or it's different every year, but it's the first day of fall, and
Mhm.
that's also National Falls Prevention Day.
Makes
So what
sense.
I did was I went to the place where I work out, and I asked them if I could hold a falls prevention exercise class, and I used Otago, and they said sure. So we did, I put up some posters and all that, and had few people sign in. And when I got there that day, only 2 or 3 people had signed in, and I'm like, oh no, this is gonna be terrible. Nobody's coming to my class. Well, I got to the class, and there were 26 people there. Two of
Right.
them were in wheelchairs. Three of them had walkers. And they all did all of the exercises. They did great. And at the end of the class, people were coming up to me saying, can we have this class again? Can you do this class all the time? And one person said, can you come to my home and give me these classes?
Mm.
So I knew when, with very little advertising that many people showed up, and that some of them weren't even mobile, that there was not only a need for the class, but also a craving for more education of falls prevention.
Right. So yeah, the Otego program you shared with me is like an evidence-based, a solid
Hmm.
evidence-based program. So they all loved your program. It was awesome. You had a great success
I
there.
know, I was shocked.
And that's awesome. So did that sort of inspire you
Yeah,
to think about the problem a little bit kind of in your head, like, okay, how do I create something that can deliver this and
right.
leverage technology? Is that what your thoughts were, or what was that like?
Yeah, well, also, I knew that I definitely, besides doing the exercise programs, I wanted to give them a little bit more education as well. So when I developed the app, I incorporated a home safety checklist, which you can print out or email to a friend. And home safety is also a very important component of falls. They trip over,
Mhm.
throw rugs, and that sort of thing. There's also in the app, there's what do you do if you fall? So then there's instructions on how to cope with what you do if you're on the ground and you can't get up. And another one's what were walking tips, safety for walking, how to walk safely.
Okay.
So there's, you can't just throw out one component because so many different things, affect why people over 65 fall. Medication review is important. Prescription, your eyeglass, the right prescription is important. So we need to put all those components together and not just the exercise class.
Yeah, so your program is more than just exercises. It's sort of a one-stop shop for, uh, especially I think it would be valuable for caregivers or people who are caring
Hmm.
for their parent or involved in their elder parent's care. I mean,
Hmm.
that's good information. I know as a physical therapist, I'm constantly looking at their environment and looking at
Hmm.
things beyond exercise, which are often the most important things for preventing falls. So
Right,
it's really, really
right,
cool that you have a program beyond that. So.
right,
What
exactly.
about, so how were you certain they'd use an app though? I mean, because these people loved your material obviously, but you're I don't know too many 90-year-olds that are on iTunes. I mean, maybe 65-year-olds. But
Hmm.
what were your thoughts around that? Were you worried about that or what?
Well, I did also do some research on, how many seniors are on the internet. Would they even find the app? How many seniors, are into technology? And I was really surprised to find that well over half of seniors are on the internet, and not just on the internet, but very active. They get on there every day. Even Facebook. They're big Facebook users. It's huge. They love Facebook, probably because of they get to see their grandkids' photos. And 11 million seniors own a tablet. So that's when I knew that it's a niche market, but still a market.
Right.
And it's really important because every day 10,000 people turn 65.
Hmm.
That's a lot.
Yeah.
So it's not going to get better. It's not going to get smaller. It's just going to get bigger as people age. And so yeah, I did some research on the how many people are on the internet, and and of course we also target caregivers. The younger, the children who are taking care of their parents, or home caregivers who can download the app and deliver the program to their you know. Oops,
No problem.
sorry.
No problem. Yeah, that is cool. Like I know a friend of mine in particular who is a close friend of mine who's heavily involved in the caregiving business. He's actually an expert on that, and an
Hmm.
application like what you have would be absolutely awesome for caregivers. I mean, think about having a checklist or an items list or in exercises that they can do with the person they're caring for. I mean, that's valuable.
Hmm.
That is a really cool market, and I think you're hitting the right time there because I mean, obviously we got an aging population. as you said, technology isn't going to go in reverse. There's only going to be more people coming into online and applications, not
Mhm.
less. It's just we're not going to go backwards. So I think
Mhm.
there's a huge market that's coming into place for that older age group with, like you say, mobile apps, technology in general. Wouldn't you agree?
Yes, absolutely,
Yeah.
absolutely. Yeah.
So
I mean, I know a lot of people in their mid 60s with a tablet, a lot.
yeah,
So
yeah.
it's just going to get bigger and bigger.
Yeah, yeah, that's exciting. So for all you guys listening out there, if you are, in that older targeted, area, don't forget about that group. They are savvy and they are growing. So, and Mazy's done the research obviously and has a lot of good statistics to back that up. So that's something to not forget about. So what challenges did you face going through creating the iStandfit product and in the app? I mean, were there struggles with that? Was it easy? Could anybody do it? Um, what was that like?
Well, I mean, I think I should give you a caveat if anybody out there is thinking about it, because, there was at least one big mistake made.
Perfect.
And this is something that everyone needs to know about, and most people don't know about.
Hmm.
A mobile app or any app, a web-based app, like my remote patient tracking app, those have the core of the app is called source code, right? Like the movie, source code.
Hmm.
And when you have a developer create an app for you, you better ask them who owns the source code,
Mm.
because even though you paid them X number of dollars, and it could be a lot of dollars, they can still say that they own it.
Mm. Okay.
So yeah, that was a problem that I encountered, and I had to have, instead of suing them to get the source code, which I clearly owned, I had to have another developer rewrite the entire app so that I have the source code. Because if you don't have the source code, you really have nothing. I mean, you can't sell the app. You can't, I mean, you can still use the app because it's on iTunes and you get paid for it, etc. But whoever does your app, if you want to have it done, make sure that you own the source code and that's in the contract.
Was that the biggest challenge? Was just that? I mean, was the rest of the
Yeah,
process pretty
yeah, it
easy or?
was. No, I mean, I wouldn't say it was easy. I mean, when you're dealing with a lot of different people who, one guy's doing this part of your app and one guy's doing this part of your app, it's very hard to coordinate sometimes. But yeah, I'd say that was probably the biggest challenge.
Okay. Yeah, yeah. So here's a weird question, or I think a fun question, and you can answer it or just say whatever to that. What are the so there's so what are some of the other ideas that you think are possibilities out there around the elderly population, in particular when it comes to technology and mobile apps? Do you have any other ideas? Now, don't give away yours that you're going to work on, but maybe some other ideas or just thoughts in general around technology and the aging population.
Wow, that is a
Got you.
high. Yeah, I was not expecting that because my brain is so full of my stuff.
Ah, yeah,
I don't know if I could even leap to another concept.
yeah, no problem.
Yeah, that good one.
I
Stunned
got
me.
you.
Did
I
not
got you
see
on
that
that one.
coming.
I got you. Yeah. So I think, like you said earlier, though, like fall prevention is huge,
Mhm.
and home checks, particularly apps that target caregivers, I think is huge. And exercise, probably medication management, all kinds of stuff. I'm sure there's probably already stuff like that out there, but I think
Mhm.
it's. I think wouldn't you say that the app industry for the elderly or even middle age is sort of in its infancy, or do you think it's
Oh,
getting
absolutely.
saturated?
No, no, it's definitely in its infancy. I mean, you're not bragging or anything, but nobody else is doing online streaming for falls prevention.
Hmm.
Nobody else is doing a web-based app to, remotely monitor the patients for falls prevention. I'm talking strictly about falls prevention.
Hmm.
Nobody's doing that, and it's almost too new. You
Yeah.
have to, when you have a new concept, you have to sort of wait for people to adopt that
Mm.
before they even begin, using it. So you have to wait for that market adoption, which is, it's tough. It's like, selling ice cubes to, Eskimos. It's hard. It's hard.
Right. And timing, right? I mean, timing is
Oh,
everything in
and
trend.
and the timing is great because the new Affordable Care Act does have the good parts about it are that it has a lot of prevention written into it, and I'm just hoping that falls prevention is a big part of that
Mhm.
because it is such a huge epidemic at this point, and you need to right now. Prevention is only prescribed after the senior falls, and it's kind of too late by then because after a senior falls once, they're 50% more likely to fall again,
Right.
and that one, maybe that fall is going to be the one. So we need to get people doing these exercises and all of the other components of falls prevention before they fall.
Right. Yeah. We got to stop waiting until people get sick or hurt to help them, right? It's like
I know, I
the way
don't
it's set up,
understand because I mean there's dental prevent you go to the dentist and you get
right?
preventative care and there's a lot of preventative
Yeah.
care out there, and I don't understand why falls prevention is not a part of that.
Right. Right. So you mentioned live streaming. Just touch on that for a minute. Like, I mean,
Hmm.
how does that set up, and like, so how does that interaction work between your app and say like somebody's, iPad or somebody's smart TV, or how does that signal
Hmm.
go?
Now, with the online streaming, what our purpose was for making that available was not just and you log in, you have a login. It's a subscription. You log in and you're able to stream either Otago or Tai Chi, either one.
Hmm.
And you can stream it to your computer, or clearly you can stream it to a TV. If you have Apple TV and you have an iPad, you can stream it directly to the big screen TV. But the reason that we made online streaming available is because if you want to stream it to a large screen, you can give group classes. And
Mm.
that's one of the big problems of falls prevention is limited throughput. Because right now it's only covered for one-on-one, PT to patient or PT to senior. So what we want to do is increase throughput exponentially by giving group classes. And group classes aren't just good for increasing throughput. You get a bunch of seniors together, and you're going to reduce isolation, which is a problem with seniors. You're going to reduce the risk of depression, which is a problem with seniors. I mean, I'm not even a senior yet, and I'm depressed just thinking about getting old. So,
Right. Yep.
so there's a lot of plus sides to having senior classes.
Yeah. Yeah. It's great for them. It's great to keep them involved and mobile and just like you said, mentally engaged as well. So
Absolutely.
it's a neat thing that you're doing. So
Hmm.
where where do you see your product and company going, say, in the next couple years? Like, I'm sure you think about that. If you don't mind sharing that, like, what are you looking to take this to?
Well, hopefully, what's going to happen is there's a lot of these companies out there now called ACOs, Accountable Care Organizations, which you
Hmm.
may or may not have heard of. And they're all volunteers of healthcare providers, doctors and nurses, and hopefully PTs like yourself. And and they're patient engagement focused. And what we're really hoping is that these are the people who are going to really start engaging patients before bad things happen. Not just with falls prevention, but with all other kinds of prevention. And we're really hoping to get them involved so that we can get a much larger patient population taking iStand falls prevention. And with the remote patient monitoring, which is it's a big buzzword now, and everybody's trying to get remote patient monitoring
Hmm.
going. But this is actually one application where it's going to help seniors because a lot of times they can't leave to go to the healthcare provider or whatever, and it's just easier for them to do it at home. And so we're trying to get ACOs, with the remote patient monitoring, and we're just going to put them together. And in 7 years, we hope to have everyone educated in falls prevention and taking those group classes.
Right. Yeah, and I think you're right. I think that prevention is going to be more prevalent, especially with the Affordable Care Act. I know there's a big emphasis on prevention. It just makes sense from a monetary standpoint too. I mean,
Yeah.
we all need to take control of our own health and our own thing. And if we're
Mm-hmm.
educated and we're motivated and we have the support, I think that can definitely become more prevalent. And that's cool that you're a part of that. So
And it's not that healthcare providers, and you're one of them. It's not that you don't have enough to do,
uh,
but it is kind of nice that that you guys are being sort of being held more accountable. Not that you're not doing your job, you know what I mean. But if you're held accountable of what the care that you provide to your patient, then you become more involved automatically, and you don't just stream a patient through, administer some exercises and a pill, and move on to the next one. I mean, that's what care. It's why it's called health care. You're supposed to care.
right.
So.
Yeah, you're supposed to care, definitely.
Yeah.
I hope that's the case, right? Most of us probably do. So.
Yeah, I think so. I think so.
So let's switch gears and get back to your kind of business strategy with this. How did you gather up eyeballs to like support you, or like people to support you? Like, how did you, when you were first starting, and then maybe even today, how did you market? How did you share your vision so that you got enough support to get the ball rolling?
Mm-hmm. Well, I started with the easiest avenue today, which is social media.
Mm-hmm.
I became much more savvy about Twitter, which I wasn't really so much before, and Facebook and all that sort of thing. And it became apparent quickly, apparent that I can't go to all these social media outlets every single day and Twitter this and Facebook that, and because it took my whole morning really.
Yeah.
So I found Buffer, and so now I use that for postings and letting people know what's going on and what's new, and what the prices are, if they dropped, or they that sort of thing. And also I have a public relations woman who just started, hitting the streets basically, and getting on the phone and calling senior websites and senior publications and telling them about our product. And some of them would do an article online, and I have a local business, Birmingham Business Alliance, that did an article. So basically, I think that's how it started. But this is an interesting fact, and it may shock you because I was shocked. When I loaded the mobile app, this was a year and a half ago. When I loaded the mobile app onto iTunes, I hadn't told anybody it was up. Okay.
Mm-hmm.
The first month there was like 200 downloads.
Wow.
And nobody even knew it was there. So that means that people were actually going on iTunes and typing in falls prevention, because my mobile app is the only one that is for falls prevention exercises. It's the only one, period. Wow. So the fact that people were typing in falls prevention made me really, it made me feel good about what I was doing, and it gave me a reason to keep going. And and you need that. You need that as an entrepreneur to get a little, boost. And because, there's not a lot of people around you, surrounding you, that's, keeping you going. So that was nice.
Yeah, so you got, like you say, iTunes is a lot of organic traffic from that. And again, PR campaigns, I know this is the second time I think this has been brought up on the show, was that beyond iTunes, which obviously helped you a lot, get a lot of organic traffic, right. Was that the most successful strategy for getting your message out, was the PR campaign?
Yes, absolutely,
Okay.
absolutely. That was probably the best. That one, and surprisingly, Twitter was, out of all of the social media outlets that I used, Twitter was the most effective.
Okay.
I don't know why, but it just was. So.
Right. Okay. Well, thanks for sharing that. Yeah. What would you do differently if you could start over? Let's say you hadn't started your business yet, and you have your brain that you have today. What would you do differently
Hmm. Um, you do still mean falls prevention, right?
with
You don't
your
mean
with your
you don't mean
business?
sail around the world instead of okay.
Yeah, with your business. Yeah.
Okay. Um, hmm. What would I do? Mm, I can't say that I would have done anything. I do wish I had started the remote patient tracking sooner.
Hmm.
But it's a learning curve and it's a process, and you have to go through everything to get to where you're going to go.
Hmm.
And it happens the way it happens, and there's nothing you can do about it. You meet the people that you meet, and they give you ideas, and you just can't make that happen faster or differently. So
Right.
yeah.
All right. All right. So yeah. So what's a couple? I know you mentioned Buffer app, and you mentioned social media places like LinkedIn or Facebook or Twitter was successful.
Mhm.
PR campaigns. Is there any, if you don't mind, are there any like specific resources that you used beyond those? Like, was there a particular PR company that you're comfortable sharing, or were there any other, helpful resources that you used along your journey?
Yeah, an invaluable resource. Well, two actually. The first one is
Okay.
odesk.com.
Yeah.
Odesk is the greatest thing since duct tape. I love Odesk because if you need, like for example, I had to re-edit the Tai Chi video, right? So to find someone to do that, it's not easy if you don't have an online resource like Odesk. Odesk, you just go in and you put up the job,
Yep.
and 100 people apply, and they're all over the world,
Right.
literally.
Right.
So the CAD drawings were done by a guy in the Philippines. I had part of my website done by a guy in India. It's a wonderful resource.
Yeah.
And the other one would have to be LinkedIn, because all probably 1,200 out of my 13 contacts on LinkedIn are physical therapists.
Hmm.
So that is a great, great resource for especially healthcare,
Yeah.
because there's a lot of groups that you can go to, and they post the most wonderful articles. And you don't have time to go through the whole internet every day and look for new articles to read and things like that. So people post, the most pertinent things on the groups that I'm a
Right.
part of on LinkedIn. So those are the two greatest online resources, I'd say.
Yeah, those are great. And the Odesk is, like you say, a powerful way to just outsource what you don't know how to do. There really is
Fantastic.
no excuse anymore for any of you guys out there who say,
Exactly.
I can't build a website, I don't know how to package an ebook or create a
Hmm.
video course, or
Hmm.
that there are lots of people out there that you can do for an inexpensive cost, and
Very inexpensive. Yeah, very
it's
inexpensive.
it's powerful today. So no excuses, guys, and get on LinkedIn too. If you're in healthcare, that's the best way to network with professional people. I know I go on there every day and try to meet at least a couple people, and you just meet so many people. If you're in business, or like for my show, I find a lot of
Absolutely.
great people to talk to and make friends with, real friends, and also have people on your show or your other business partners. It's a cool resource. So
It is. It's
tell
great.
us tell us a little bit about give us a book or two that you love that are related to entrepreneurship or business, or somewhere in that thread that some of our viewers could check out.
My favorite business
Nope. Hello.
by John Huntsman,
Oh, what was that again?
and Winners Never Cheat by John Huntsman.
Winners never cheat.
Yeah. And if you don't know who John Huntsman is, well, you can Google him. His son is also a big hotshot business guy. But John Huntsman Sr. started the John Huntsman Cancer Institute. But way before that, when he was young, he invented the styrofoam egg carton.
Mm.
So that was his first business venture.
Wow.
And he's the most wonderful man. He has a great heart, and his goal in life is to die penniless. He
Wow.
wants to give it all away.
Wow. Cool.
I know. And so the book is just really well written, and it's something that I try to follow, because you can watch all those shows on TV that portray capitalists and business people as heartless, godless, horrible people, but you don't have to be that way, and it's not really that way, except maybe in New York.
Uh-oh. No
I can
offense to
attest
anybody
to
in New
that.
York there.
I can attest to that in New York. I'm not kidding. I used to live there. That's where I went to graduate school, and it is a scary place for business. I'll tell you, it's scary.
Yeah. Yeah.
Yeah.
So winners never cheat. That's the book recommendation, and I'll have to check that out. And guys, there's a
Very
cool
good.
deal we have here at New Wave Healthcare. If you go to newwavebooks.com, you can get a free audio version of that book or any other book,
Oh,
courtesy of audible.com. So go to newwavebooks.com and check that out.
nice.
Yep, free audio version, not bad.
Sweet.
And so what's let's do this question here. What's here? I got to put this back on me. What is the biggest change you see coming to healthcare?
Well, I don't know if I see it, but I'm hoping that it is I'm hoping that prevention is the key to everything. And I really hope that people embrace and adopt the digital age, because it's going to change everything in healthcare. And I hope that people aren't afraid of it. Like, I still know people who don't have a cell phone. So, it's hard to convince everyone, because a lot of people don't like change. But I just really hope they adopt and accept the digital age.
Right. And I think they're heading that way. I think, with government regulations and changes, I think um, that we're certainly heading that way. So I think prevention is getting more awareness, and also, the use of technology is from a financial standpoint, and also from just an improvement of efficiency and
Hmm.
accuracy standpoint. I think that we're heading in that direction. So I think you're in good company there. So
I hope so.
So, Mazy, thanks so much for your time and sharing
Thank
some of your
you.
insights. Tell us a little bit about our viewers, where we can find out more about you and your current business, and then we'll say goodbye.
You can read and learn most about what my products and services are all about at iStandfit.com.
Hmm.
That's where, that has, I have everything on there, including clinical trials and reports on the evidence-based programs that we use. So if you're a PT or any healthcare provider, and you're not familiar with Otago, or you're a little skeptical about the Tai Chi and what it can do, go to the website and read the clinical studies that were done on these programs.
Okay, perfect. So go check out Mazy at iStandfit.com. Thanks again for your time. We
Thank
appreciate you
you.
very much. So thanks, everybody. I hope you enjoyed this show. We had a lot of great content, particularly in the mobile application field. And, that was just very insightful stuff on, kind of how to create an idea, how to get an idea and transform that into a mobile application. Talked a lot about technology and fall prevention, and don't forget about the elderly generation. Those guys are they're savvier than you think, and there is a market there for especially for entrepreneurs in the healthcare industry who are going to try to use technology to reach that group. So don't forget about them. And as always, you can check out this interview. It'll be archived on the newwavehealthcare.com/interviews page. I'll actually make a page there for Mazy and have some of the links and resources to her stuff and the other resources mentioned during this talk on that page. And I'll probably have that up, probably by Wednesday night. Yeah, so that's good. Our next talk will be the 25th, November 25th at 4 p.m. Pacific, 7 Eastern. We'll have another great entrepreneur in the healthcare industry come on and share their stories, their challenges, their resources, and the process they went through to create what they're doing. So stay tuned. I will shoot out a message on social media, and if you're on my list, my email list, I will be shooting that out shortly. So have a great Monday, everybody. I will see you next Monday, 4 p.m. Pacific, 7 Eastern. Take care.